My name is Marcia Wasserman. I'm a pediatric neuropsychologist at the Alberta Children's Hospital, and today's workshop is going to focus on thinking and learning in school-age children. And we'll talk a little bit about some of the cognitive findings that we find, and then we'll talk about some of the more common diagnoses that we often see in this age range in kids with congenital heart disease. But before we move on to that, I'm going to have Rachel give some acknowledgements.
I'm Rachel Varghese. I'm social worker with Cardiology Clinic here in Calgary at the Alberta Children's Hospital. And I just wanted to take a couple of minutes to have a few acknowledgements before we start today's session. Welcome to everybody. The first will be the land acknowledgement based on where we're broadcasting from and based on where our Alberta Children's Hospital is located, which is in Calgary, Alberta, in which acknowledges and pays tribute to the traditional territories of the peoples of Treaty 7, which include the Blackfoot Confederacy, comprised of the Siksika, the Kainai, and the Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including Chiniki, Bearspaw, and Goodstoney First Nations. The city of Calgary is also home to the Métis Nation of Alberta, which is Districts 5 and 6. And on this land and in this place, we strive to learn together, walk together, and grow together in a good way. The second acknowledgement we wanted to make was also just to acknowledge the purpose of these sessions and that they're all offered with the intent of providing education, resources, and learning. And with that said, not all of the information will be applicable to all families and parents and others attending, but hopefully provide some aspect of your child's growth and learning to consider. And just to open up that conversation with your cardiology team, whether it be here in Calgary or elsewhere, wherever you're joining us from. We want to acknowledge and recognize and normalize that some of the information presented you might find difficult in terms of hearing or what you see on screen, and in that it may trigger some emotions for you as individuals, as parents, as caretakers, as people involved with the children we're talking about. We want to acknowledge there are resources available for support. So whether you're here in Calgary and your care is located at the Alberta Children's Hospital, if that's the case, we have psychosocial support, myself being one of the members of that team. And there's people within your clinic that you may want to speak to after these sessions if you're feeling that there's any kind of impact for you. If you're coming and joining us from other centers, then there are also mental health supports within your community and within your medical team that we would encourage you to reach out to in order to discover what supports may be available specifically to you in your community. With that, we'll pass it back to Mark.
Just to give a little review of some of the stuff that we talked about last time that not everyone might have heard. Kids with congenital heart disease do tend to have higher rates of early developmental struggles. And so some of the stuff that we'll be talking about today will build on that. We know that kids with congenital heart disease tend to have generally low average to average intellectual skills, but may struggle in more specific domains like language and motor development, visual spatial skills, attention. And I'll be talking about each of those more specifically throughout today's session. And I'll start off with motor skills. We know that kids with congenital heart disease do tend to have a higher rate of motor skills difficulties, and these are seen pretty early on as well, especially in gross motor. And that's why physical therapy, occupational therapy are often integrated into those early teams that follow kids with congenital heart disease. These are two very separate sets of skills. Gross motor skills are things like large muscles, running, jumping, balance, and fine motor skills are more small muscles. So things like dexterity, being able to do up your zippers and laces, coordinate movements, and as kids get a little bit older, drawing, copying, and handwriting. Fine motor skill difficulties often are not seen until kids are a little bit older because young kids aren't doing a whole lot of fine motor activities early on. Although those early skills include grasping, the pincer grasp, being able to pick up those Cheerios, but some of those difficulties may not be evident until kids are a little bit older. As I talk about each domain, I'll talk a little bit about interventions as well. And the most common motor interventions are physical therapy, right? So those are folks who really work on gross motor skills. Occupational therapy work more on fine motor activities. And those are the two largest areas of intervention that you'll see kids with congenital heart disease get. As we get a little bit into school age, handwriting is something that we tend to start to see become more affected. So handwriting needs to be explicitly taught. And unfortunately, a lot of school programs don't teach it anymore. I'm sure that a lot of you might remember, I know when I was growing up, penmanship was a separate kind of class, and you were taught how to handwrite. That's less of an explicitly taught skill in school now. There are some specific handwriting interventions that are often recommended and that are often used by occupational therapists and in schools for kids who are struggling with handwriting. The efficacy on that literature is pretty limited and inconsistent. What we do know is that teaching handwriting works to improve handwriting, and the transfer of other motor skills interventions does not always translate to improved handwriting skills, but specific programs are less consistent in terms of whether they work or not. That being said, I will cover a couple. These are the most common handwriting programs that you might see. Handwriting Without Tears is probably by far the most well-known and one that is used across schools. There's something to be said about it does work for some kids, it doesn't work for others. They do have some really good materials that kids find more engaging. So just by virtue of making it more engaging, it might be more beneficial to some kids. And then the other two that we often see is Right Start Handwriting and Size Matters handwriting programs. And both of those have had some literature to say that they are kind of effective for certain kids. So for kids who struggle with handwriting, explicitly teaching handwriting is going to be really important. The other domain that's really important as kids enter school is obviously academic achievement. That's what we're asking kids to do throughout their 12 years of education, right? Achieve certain goals and certain benchmarks in each of the academic domains. And for younger kids, it's really reading, writing, and math. What we know about kids with congenital heart disease is that the rates of special education services, such as tutoring, remedial instruction, is much higher in kids with CHD. And we know that kids with CHD tend to have lower math achievement, lower reading comprehension, lower spelling skills as a whole, as a group. And their likelihood of needing that extra support also increases with the increasing rates or the increasing severity of the heart disease. The more severe heart disease a child has, the more likely they are to need some extra help in school. I'm going to spend a good chunk of time talking about specific learning disabilities in reading, writing, and math, what they look like, and what the interventions are for each that we know to be effective. When I talk about reading, we're really talking about phonological awareness, sorry to skip back there, basic reading skills, as well as comprehension. The term specific learning disability in reading is used to apply to any of those areas. So if you have a comprehension difficulty, that's specific learning disability in reading. If you have a basic decoding difficulty, that's the same terminology is used. This is also what used to be known as dyslexia. And I'll talk more specifically about what all of that is. We know that certain cognitive skills are affected in aspects of reading. So for example, in basic reading, we need phonological awareness skills, we need working memory and processing speed. Working memory is not memory. It's a bit of a misnomer. It's basically attention, being able to hold information in mind, being able to juggle it and manipulate it as you need it in order to solve some sort of problem. And processing speed is exactly what it sounds. It's speed, how quickly you can do certain things. Math is much more related to visual perceptual skills, being able to visualize information and reason with with spatial material, non-language based material. And working memory and processing speed are also very much involved in those. And as you can see, a lot of the cognitive skills are similarly involved across all of the academic domains. With writing, we need motor skills, we need planning, we need organization, we need attention, speed, as well as the ability to spell and blend sounds into words. So lots of skills needed across all of those. What is a specific learning disorder with impairment in reading? That is the current terminology. As I alluded to a little earlier, this is what used to be known as dyslexia. Reading disabilities are based in language. A lot of people have a misconception that dyslexia is flipping words or reading things backwards, or and there's definitely some of that in terms of the symptoms, but the reason that they exist is because there's a deficit in the sound symbol learning and the sound symbol association. Language difficulties early on are a significant predictor of reading development, and that's particularly true for phonological awareness. And we know that kids with congenital heart disease tend to have greater levels of early language difficulties and also tend to have more difficulties with aspects of phonological awareness. So what is phonological awareness? When kids are young, it's that rhyming ability. It's the ability to kind of understand that words sound similarly, that cry and fly rhyme. It's being able to isolate certain sounds within words, being able to learn that certain letters make certain sounds and that certain symbols have a certain sound association. But here's an example of phonological awareness. Those wordplay skills are really important in young kids. And when we see kids struggle with any of these, that is definitely a red flag for there might be some later reading difficulties, because these are the building blocks for all later reading skills. And when kids enter preschool and kindergarten, these are the skills that a lot of times are being worked on, right? Being able to take apart a word into its separate sounds and put sounds together into a word and identify those rhyming words as well. When we think about remediation, we'll talk a lot about remediating some of those phonological awareness difficulties, and we're much better at making kids accurate readers than we are at making them quick and fast readers. So fluency is a related but also a potentially separate area of difficulty. There are kids who are able to sound things out and understand the sounds of language, but they can't do it quickly enough. And so their fluency suffers, and it takes them longer to read, and it takes them longer to get to the end of the passage. And then that will obviously affect your comprehension as well. And comprehension can be a separate entity of area of weakness for a lot of kids. And it's often related to more executive functioning skills. And I'll talk about those coming up, but more specifically, working memory, being able to keep track of what it is that you're doing, and organization, right? Organizing that information that you're reading and figuring out how to make connections between what you're reading now and what you read earlier, what you might be reading going forward. So, knowing that we have a higher rate of likelihood of reading difficulty, how do we help? I got to say that we have a lot of information on what works in reading. There's been a lot of literature, a lot of research really looking specifically at how do we teach kids to read, what's most effective. In the early 2000s, there was a national reading panel, and more recently, you might have heard of the science of reading, and the CBE is kind of starting to jump onto that, at least in Calgary, onto, hey, there's all this research on what works in reading, let's start using it. And up until this year, that really wasn't the case. And what works is intensive, explicit, and systematic instruction in phonological awareness, phonics, vocabulary, fluency, and comprehension. All 5 of those areas have to be addressed in a program that is effective. The intensity piece is also a huge one. Having a good intervention that is provided for 20 minutes a week is not going to be effective. So it really has to be far more intensive than that. Some examples of programs that you might hear are Orton Gillingham, that's a really big one, Wilson Reading Method, Linda Mudell. Those are all programs that are based on that phonological awareness kind of explicit instruction that have all of those components. The reality is that the program itself is less important, but having all of those components is the more important piece. And like I said, Calgary here is just starting to shift their overall reading instruction to the science of reading framework. And up until recently, it really focused a lot on whole language instruction, which was a lot of sight word vocabulary, a lot of repeated reading, a lot of repetition of just reading the same things over and over again and trying to memorize words, which in the English language is necessary. You can't decode everything in English. In fact, you can't decode a good chunk of it. So you need both phonological awareness, fluency, and that sight word vocabulary. From a local standpoint, these are some resources of interventions that work that we know are based in that science of reading. Foothills Academy is a great resource here in Calgary. It's a school for kids with language-based learning disabilities, but they also provide community resources as well as community tutoring and instruction. The Can Learn Society is amazing. They do a lot of both virtual and in-person reading remediation for young kids and older individuals. And then there's some tutoring programs like Literacy Unlocked that are based on that Orton Gillingham instructional method. Some additional resources that are more general that you could access kind of from anywhere, and you could get more local resources through each of these are on this slide. Orton Gillingham Academy actually has its own website. They have links to apps that work or that they recommend for young kids. The Yale Center for Dyslexia and Creativity is a wonderful resource by one of the premier dyslexia researchers, Sally Shaywitz, with a wide range of resources for families, for kids. Reading Rockets and Understood.org are great websites. All of this will be put into a little brochure that I will email out to everyone. So there will be a brochure summarizing all of this information, as well as a separate brochure with more specific resources for each of the areas that I'll email out to everyone who registered for the talk. So don't feel like you have to try to write this down, but just wanted to throw some of those out there. I want to spend a little bit of time talking about what does not work. And the reason that I do this is because there are quite a lot of programs out there that may be well-intentioned that are just not based in the science of what works. And we know that they're not effective, and many folks don't. So want to make sure that I talk a little bit about this. When it comes to reading, because one of the symptoms that has gotten a lot of hype is this idea of reversing letters and reading things backwards or words moving on a page. Vision therapy became a really big intervention for reading difficulties. And over time, it became very clear that vision therapy is not effective for remediating reading difficulty. That isn't to say that you shouldn't get your child's eyes checked. Yes, and that's something that I think is asked to be done before kids start school and throughout their school career. But overall, trying to address a visual problem for a language-based learning disability has not been proven to be effective. Special lenses and overlays also don't seem to work, nor do special font. There's other kind of approaches that have come out, including the whole language reading approach, the Davis method, which have not been shown to be effective for improving basic reading skills and reading achievement in kids with underlying learning disabilities in reading. The vision piece has become so prominent that the American Academy of Pediatrics, as well as the American Academy of Ophthalmology, had put together a joint statement on learning disabilities, dyslexia, and vision, saying that visual interventions should be avoided and interventions that have a good amount of research behind them should be used instead. One of the other things that I often talk about and recommend is assistive technology. And assistive technology is one of those things that's a bit of a two-way street. We obviously want to make sure that we're providing the right intervention, that we're giving kids the tools that they need to try to remediate some of the difficulties that they have. However, there are aspects of learning disabilities that don't tend to improve as greatly. As I said, fluency is one of those pieces. So even with intensive, well-developed remediation, a lot of kids with reading disabilities and dyslexia will not become very fluent readers, which means that it's always going to take them longer. They could get through it, they're able to decode it, they're able to understand it, but it takes them longer. And at a certain point in a child's academic career, that becomes quite a detriment, right? If it takes you twice as long to read a book or twice as long to read an exam, that's going to become a problem. And so this is where assistive technology can be a great way to ensure that students with learning disabilities have greater access to the curriculum. And there's also been some literature that shows improvement in basic reading skills with the use of assistive technology, in part because we're continuing to foster language development. If you think about young kids who are trying to learn to read and who are struggling, they might be quite capable of understanding a book and being able to discuss it and answer questions about it that they cannot actually read. So if they can't read it and they're not listening to it, they're not learning the language and the vocabulary that comes with it. They're not learning some of those comprehension skills, and they're missing out on the social piece of literature as well, especially, you get to grade 3, 4, 5, and kids are talking about books that they're reading. But for kids who aren't able to access that, they're not able to participate in it as well. Using things like audiobooks can be really helpful in mitigating this piece and also overcoming some of these hurdles, giving kids access to the language and the literature and the text that they are otherwise not able to access themselves. There is some worry about kind of technology interfering with the learning of basic skills, and I'm not going to say that there's nothing to this. There's definitely something to the idea that if you introduce technology too early or certain technologies too early, it might interfere with some of the skill development. This is particularly true in handwriting. Trying to explicitly teach handwriting in early grades is probably a good approach rather than immediately jumping to assistive technology. But when it comes to reading specifically, even early introduction of audiobooks and text to speech can be quite beneficial and has been shown to improve reading as well. Here are some of the assistive tech recommendations that I often make. And I think for each one, the goal is to try to think about what is it that the task we're asking a child to do, what's the purpose of that task? If the purpose is to assess their reading skills, then maybe an audio version would not be appropriate. But if the task is to assess what they know about science or math, making them read the questions is then going to interfere with what we're actually trying to get at. Audiobooks, text-to-speech software for computers, readers of exams are always really important for kids with reading disabilities. For older kids, especially for more high-stakes exams as they get older and into high school, C-pens can be really helpful. These are little scanning pens. They're little tiny scanners the size of a pen that basically read what they're scanning to you. You hold it over a question and it reads the question to you. And again, if the purpose is to see what their knowledge is of specific content, then taking that reading hurdle out of the equation will give us better information about what a kid is able to do. Dictation for writing, speech to text is really helpful for older kids with writing disabilities, especially if the goal is to figure out what they're able to produce and the content that they're able to develop. And then fillable PDF worksheets is another resource for younger kids with fine motor difficulties. So they might not be able to get their answer onto a handwritten sheet, but they might be able to type it in to fillable PDF worksheet. Some of the assistive tech resources work, some of them don't. How do you know where to go, what to get? There is a website that's continually being developed called athelp.org. It's by an assistive technology guy out of New York City. And it's divided really well into areas of assistance: reading, writing, speech, language, alternative communication devices, physical mobility, orientation, all of those. And then a wide range of technological resources, both hardware and software. So that's a great resource I often recommend. It's constantly being updated. In terms of audiobooks and audio content, the library. Any local library now has access to a ridiculous amount of audio content. The Calgary Library digital catalog is huge and includes Libby, which is like an overdrive type of software, Tumble Books Library, Bookflix, Team Book Cloud, all of those. So you could really access pretty much anything, especially literature, through the local library. For kids with more specific reading disabilities or other print disabilities, bookshare.org is a great as well, because they are able to access and provide access to educational texts, so science textbooks, social studies texts, physics, whatever it is, in audio formats. They're not perfect, but they do provide a pretty good option for many kids. And the Center for Equitable Library Access, membership with Center for Equitable Library Access in Canada provides free access to Bookshare if you have a diagnosed disability in reading. Okay, moving on to math. I'll talk a little bit about some of the developmental patterns in math that we see in kids more generally. As a heads up, we do not have the same level of research on math as we do on reading, but it is developing and it is improving. There just isn't as much out there on it. But approximate number sense is present in newborns. Until I started looking into this quite a few years ago, I had no idea that newborns have an innate kind of sense of number representation. And this primitive number sense at a young age, at 6 months, does predict math skills at age 3.5. So it's not just like a random kind of thing. That's by 10 months of age, babies can identify different number groupings. They might not know that this one's bigger, but they can tell that they're not the same. And early math skills in toddlerhood relate to math development later on, include a wide range of things. So understanding that numbers mean how many, that's probably one of the first math skills that we tend to see develop in kids. In toddlerhood, they start to recite numbers. They don't know what the numbers mean necessarily, but they're able to repeat a particular sequence. And they start to understand that words compare and measure things: more, less, faster, slower, under, over. They're able to match basic shapes and colors. And pattern recognition is a big math predictor. It's very much related to math development. They start seeing patterns everywhere. If you take a toddler or an early preschooler for a walk, and all of a sudden they see all of these patterns kind of in their environment. Like I said, there's less research in math. We're getting better at it. But what we do know is, from a cognitive standpoint, math is often associated with visual, spatial, and perceptual skills. And the reason that I highlight that is because the visual perceptual domain is one that's far more likely to be affected in kids with congenital heart disease. And so math is often an area of academic achievement that is quite a struggle for a lot of kids. There's also a really big overlap between math and reading strength. And the reason for that is the area of the brain that's involved in, especially that phonological awareness, that learning of sound symbol association, is also involved in the automaticity of a lot of behaviors, particularly math facts. When kids are just starting to learn their facts, it's every time 3 plus 3, they're doing 3 plus 3 is 6. And eventually, just like any skill, just like when you were learning to drive and you really had to focus on every piece of driving, where's the gas, where's the brake, where's the clutch, eventually the automatic part of your brain takes that over and you don't have to give it any more thought. Same thing with those math facts. And the part of the brain that takes that automaticity on is also the same part of the brain that's often involved in those basic reading skills. When it comes to word problems, as kids get a little bit older, working memory and being able to juggle all the different pieces of a particular problem become really problematic. So if you have to keep track of Johnny had 2 apples, and how many apples did, Sally have? And wait, did she give it to him or did she take them away? Being able to keep all of those pieces in mind while you're conducting that calculation is quite difficult. Calculations seem to be related to, like I said, reading, working memory, and processing speed, how quickly you can do those. And then word problem solving tend to be related to working memory, but also more general cognitive ability, like concept formation, fluid reasoning, nonverbal reasoning skills, and language. You wouldn't think that math would be related to language, but it seems to be quite related to language skills. I hope this video works because I want to just highlight how is math taught today. I will verbally describe the video. Basically, you can watch the video and I'll tell you kind of what the kid was doing. She's saying that first you have to make this place value chart, and you have the thousands, the hundreds, the tens, and the ones. And she's going to proceed to draw each number into each of those. She'll have a little line for the ones, and then the tens will be a square, and the hundreds will be a cube. And she's going to then proceed to figure that out. This video is 3.5 minutes long. That's how long it takes her to solve this problem. Now, as I mentioned, working memory and processing speed are skills that are necessary to complete math and are often impacted in kids who might have heart disease or who might struggle. And if you need 3.5 minutes to solve what seems like not an overly complex problem, that could be probably solved much faster. This new approach to teaching math has been a huge problem for kids with any sort of cognitive weaknesses, because holding all of that information in mind and being able to do it quickly enough is just not possible given the methodology. And they're also shifting a little bit from this particular way of teaching math. And while there's definitely some benefits to kind of teaching, obviously it's important for kids to understand what quantities make up what other quantities and all the place value. This approach is very inefficient and ineffective for a lot of kids with any sort of cognitive weaknesses. What about math intervention? What do we do? It's very similar in terms of the components that are important in math intervention. They are the same components that are important in reading intervention. It has to be explicit and it has to be systematic. It has to be engaging for kids, and there has to be a lot of opportunity for feedback as well. So those are the qualities of math intervention that have been found to be particularly important for kids to learn, and especially for kids with learning difficulties. The explicit and systematic piece is really important because, again, some of the newer approaches to teaching math have these circular spiral type of approaches where you touch on different concepts at different times in the curriculum and not necessarily to a point of mastery. And for kids with learning difficulties, that could be quite inefficient and ineffective. It needs to be systematic and it needs to build on top of each other. There's also some evidence that some computer-assisted instruction can be a helpful tool, especially in developing automaticity. And some studies have found computer programming can be a helpful way of improving math as well, although I don't think that's actually translated into any school-based programs as far as I know. Like I said, there's far fewer options for evidence-based math intervention. There are a bunch of resources and online instructional resources like Khan Academy and iExcel that often are used both by schools and by families. A lot of them are subscription-based. Khan Academy is free. Parts of iExcel are free too, but if you want something that's more systematic and kind of follows a particular curriculum, then you have to pay a subscription. There is Jump Math, that's a Canada-based company that has some good research behind it. They've really done a good job of trying to demonstrate effectiveness. And Pirate Math Equation Quest is a word problem solving intervention that's been shown to be quite effective. Technology tools can be really helpful as well. So things like obviously calculators, talking calculators for kids who have communication difficulties, math notation tools like graph paper, equation solving tools. Understood.org actually has a whole page on math assistive technology that can be helpful for students at different levels of school. can definitely explore that. Given that working memory is a particular area of difficulty for kids with congenital heart disease, and it's a very necessary skill for a lot of math, especially after those first couple of grades. One of the things I often recommend is what I call math recipe cards. And really, it's a little card with all the steps to a particular type of problem, as well as an example of a particular type of problem that kids can refer to. Then they can kind of go through it step by step, checking off each part to make sure that they did all of those pieces. And rather than relying on their working memory to try to remember all those different steps. So written expression, that's the next area of academic achievement I'm going to talk about. And this is probably the most complex academic skill. It requires lots of underlying cognitive abilities. And I want you to think back to some of the areas that I said kids with congenital heart disease tend to struggle in, right? So it requires motor skill, particularly fine motor skills. It requires literacy and understanding of sounds, symbols, phonological awareness, and spelling. It requires language skills to be able to produce an idea. And it requires executive functioning skills to be able to organize your ideas, brainstorm, put them in the right order. And then you have to keep track of grammar and punctuation and capitalization, all of that together. That's a lot. That's probably more than any other academic skill, right? For note taking and even just writing on a page, you have to have visual motor integration skills and being able to organize information on a particular page. And as focus becomes more on composition, as kids get a little bit older, those executive functions take on a particularly important role. And I'll talk about what executive functioning is specifically, but things like planning and organizing and being able to sequence your ideas are really necessary for those compositional skills. We talked a little bit about handwriting interventions for that fine motor piece. For some kids, teaching them to type can be particularly helpful. Interestingly, handwriting and typing skills are highly related. So typing isn't always going to be easier for all kids who struggle with handwriting. It could definitely be helpful to some. Dictation can be particularly helpful for kids who struggle with handwriting, but that's one of those assistive tools that I would recommend you try out and see how it works for a particular kid. Spelling needs to be explicitly taught. And spelling instruction has also been shown to improve reading skills as well. Some kids are able to catch on to spelling and other kids are not. Just because a kid is a poor speller doesn't mean that they're not necessarily able to develop that skill, but it might mean that they haven't been explicitly taught. I know we used to have spelling tests. I don't know if that doesn't seem to be as a big part of academic instruction as it used to be, but definitely something to think about if a kid is struggling with that aspect of writing. For more executive functioning related writing difficulties, self-regulated strategy development is one of the most studied and probably the most robust interventions that are out there. And it focuses on some of those metacognitive skills, self-regulation, goal setting, being able to monitor yourself and monitor the instruction that's happening, and then include self-reinforcement to be able to engage and motivate yourself to then do more. They can be individualized and should be individualized to each student. And it also encourages active collaboration with peers. After some of those basic instructional components, students can work together to really help support each other in the writing intervention. I mentioned dictation already, and then graphic organizers is a good tool that can be really helpful for a lot of kids. And that's particularly helpful for the planning piece and organizing piece. So these are mind mapping tools that allow kids to just put a whole bunch of ideas onto a visual format, whether it be on a piece of paper or PowerPoint slide or a mind mapping tool, and then physically manipulate it to figure out what should come first, what should come next, how to expand on a particular area of topic to then produce the best content that they can. Moving on to attention, lots of different types of attention. And when we say attention, it could mean a wide range of different things. So I said working memory is really attention, which it is. But unfortunately, I think most people hear memory and they think of memory. And in fact, when a lot of people talk about memory, they really are talking about attention. I have a lot of families who will come in and say, you know, I tell my kid to do these few things and then they forget. They must have a memory problem. But the reality is that really relates to being able to store information for long-term use. Um, and when we give kids a three-step instruction, that's really an attentional component. Are they focused on what you're saying? Can they juggle those three pieces long enough to complete the task? So it's not memory per se, it's more of an attentional skill. There's auditory attention. Is the kiddo listening to you? There's visual attention. Are they paying attention to what's on the screen, what's on the paper in front of them? A lot of kids with attentional difficulties, you give them a math sheet that has subtraction and addition on it, and they'll get stuck on subtract, and then they'll just subtract everything, even though the symbol has changed. So that's more of a visual attention. Divided attention is being able to split your attention into between two different stimuli, kind of multitasking. Shifting attention is being able to disengage your attention from one thing and shift it to something else. And a lot of kids with attentional difficulties really struggle with this. And what that looks like is they're hyper-focused and they can watch TV for hours. They could play video games for hours. And in fact, if they're playing a video game and I tell them to come to dinner, they do not hear me. They can't disengage their attention from one thing, particularly it's something that's motivating, to something else. And sustained attention. This, I think, is probably the one that most people think about when we say attention, is being able to sustain your focus and attention for a long period of time. So sit in class, listen to the teacher, sit and do your homework for a half hour, kind of sustain your effort. Along with attention is this other umbrella term called executive functioning. And this is something that I'm sure a lot of people have heard of. It gets thrown around a lot, but even within our field, we don't have a good, solid definition of what that is. So it depends on who you talk to, what model you're looking at. Everyone agrees it involves a wide range of skills, but what specifically is probably more up for debate. It's an umbrella term, and it covers a lot of skills that are necessary to orient our behavior towards reaching some ultimate goal. In an adulthood, it might mean the things I need to do to reach my ultimate goal of getting a promotion or buying a home or achieving some sort of skill. Kids aren't as good at having long-term goals in mind, so they need things broken down a little bit more, but it includes things like planning, organizing, breaking things down. If you get a large assignment, a large project, figuring out how to break it into more manageable components, being able to manage your time, manage your belongings, being able to inhibit responses, not do the thing that you really want to do or not call out when you're in a class. All of those behaviors that are necessary for reaching a goal. Attention and executive functioning difficulties are very common in kids with congenital heart disease. And in fact, they're probably the most common area that we see children struggle with, in part because they're also far more widely dispersed throughout the brain. Almost anything will affect attentional networks and executive functioning. Within that context, we don't have as much that we know works for executive functioning difficulties. There's definitely not much that has looked at these interventions specifically in kids with congenital heart disease, right? A lot of the attentional executive functioning intervention literature has come out of brain injury, so cognitive rehabilitation. And then there's working memory training programs that have come out of more the ADHD, attention deficit hyperactivity disorder literature, things like CogMed. So working memory training programs, the idea behind them is that we know working memory difficulties are common in a wide range of childhood disorders. ADHD, premature infants, kids with heart disease, they're all at high risk for those working memory problems. So can we train the particular skill? And these programs, really, they're exactly that. They train you to get better at remembering the number of dots or remembering the number of digits that are said, or being able to hold specific information in mind longer. And they are good at doing that. However, what we found is that lots of studies just demonstrating that while they're able to improve your specific working memory for the task taught, if the task itself is remember 5 digits and then remember 6 digits and then remember 7 digits, you get better at remembering digits. But that doesn't translate to anything else. It doesn't translate to academics. It doesn't translate to ADHD symptomatology. It just doesn't necessarily affect other areas of life. You're great at remembering phone numbers now, but it doesn't impact anything else. And they are pretty time intensive. And unfortunately, that hasn't been an effective intervention or strategy overall. A lot of the cognitive rehabilitation literature that's come out of brain injury has really focused on strategy development. And that seems to be far more effective. What we know tends to work is support for metacognitive strategies, thinking about your own thinking. So kind of teaching kids to be mindful of their own process and teaching them the strategies for planning and organizing. We can teach kids to be effective problem solvers and planners and organizers in a very explicit kind of way. One of the things to really keep in mind is that executive functioning and attention are also highly influenced by other factors. If you're stressed, that's going to affect how much attentional resources you have. You didn't sleep well last night, it's going to affect how well you're able to focus at work. If you're anxious or you're sad or you have a mood issue or an anxiety disorder, those are all going to affect your executive functioning skills, your attentional resources. If you're socially preoccupied and you're worried about what your friends are going to say or think about a particular thing, you're not focusing on what your teacher is saying in class, right? If you're hungry, it's going to affect focus. So all of those factors are highly related to executive functioning and attention and need to be thought about when we're thinking about those interventions. One of the interventional areas that has been shown to be quite effective is physical activity. Getting kids to be physically active shows that improves their attentional capacity and their executive functioning skills, especially more moderate and rigorous exercise. Kids obviously need to be active to be healthy, but the more active they can be, them into a physical activity program can be far more effective for their attention than some of those other interventions that I mentioned for working memory training. The other piece, I'll talk a little bit about diet as well. I want to preface that there's really no dietary intervention for attention problems that really works, and especially that works for most people. However, there's definitely a good amount of literature to say that there is a difference in the rates of attention difficulties and executive functioning difficulties in individuals who eat unhealthy, unbalanced diets, especially the Western diet. So high processed foods, highly processed sugar, low activity levels, fewer vegetables and fruits, those types of diets tend to be associated with higher levels of attention difficulties. There's definitely a chicken and egg question as well. Is it the dietary patterns that are related to attention, or is it the fact that individuals with attention problems are more likely to be impulsive, more likely to eat unbalanced diets than those who have more inhibitory control? So the jury's still out on that, but there's definitely something to be said about a healthy, balanced diet is important for a wide range of health benefits, including cognitive health and including attention and executive functioning skills. Some of the common diagnoses in kids with CHD that we see. So I mentioned that specific learning disabilities, academic achievement problems are quite common, right? In reading, writing, and math tend to be more prevalent in kids with heart disease, but comprehension and reading as well. These are the other 4 diagnoses that we tend to see a lot. And I'll talk about each of these and talk a little bit about some of the interventional strategies for you. Intellectual disability, this is characterized by significant difficulties in 2 domains. One is being intellectual functioning, and the other one is being adaptive behavior. What that means is your ability to engage in independent behavior at an age-appropriate level, both conceptually, socially, and in terms of your self-care skills. As a group, kids with congenital heart disease generally have low average to average intellectual skills. Kids with more severe diagnoses like hypoplastic left heart syndrome, as a group, tend to be at that lower end of the low average range, but still as a group broadly normal. That said, kids with heart disease have higher rates of intellectual disability than kids without heart disease. It does not mean that every child with heart disease or even severe heart disease will have lower intellectual skills, but there definitely is a higher rate of intellectual disability in kids with heart disease. From an interventional standpoint, what does intellectual disability mean? It means that kids will be slower to develop skills. They will develop a larger gap over time between what they're able to do and what their same age peers are able to do, especially in that independence and self-care skills as well as academic skills. The interventions are going to really vary depending on the level of intellectual disability. Most kids with intellectual disability have a mild level of intellectual disability, and some kids with intellectual disability do become independent and are able of independent decision making and of independent living, and some kids with mild intellectual disability are not. It really is quite variable. And then moderate and severe levels of intellectual disability are far less common across the board, including kids with heart disease, but do require much higher levels of support throughout life. The next diagnosis I want to talk about is ADHD. So there's 3 subtypes of ADHD. And I think most people, when they hear the term ADHD, attention deficit hyperactivity disorder, they think of a young kind of 5-year-old kiddo who's running around and comes into my office, for example, and tears it apart and is impulsive and hyper and just can't regulate their behavior. And that's one subtype. That's the hyperactive impulsive subtype. So these are the kids who really struggle with behavior regulation. They're impulsive. They run into the street without looking. They call out. They a lot of times alienate their peers because they're so much in other kids' space. And this tends to be more of a younger group. A lot of individuals do tend to outgrow some of those hyperactive impulsive symptoms with age. Purely hyperactive impulsive kids tend to be younger. Then there's the predominantly inattentive presentation. And those are the kids who they're not hyper, they're not impulsive. They might be a little impulsive, but not overly impulsive. In fact, many of them are kind of sluggish and maybe even a little bit of a couch potato. They tend to be really inattentive and distractible. These are the kids that you're having a conversation with and they're like, hey, squirrel, oh, there's something shiny. They're just not able to stick with it. They avoid things that they know are going to be hard or challenging, and they're disorganized. They can't keep track of their stuff. You know, you're on your 10th water bottle for the school year. Those are the symptoms of that predominantly inattentive presentation. And then there's kids who have both. They have the inattentive symptoms, the disorganization, the distractibility, and they have the hyperactive impulsive symptoms. So those are the 3 main presentations of ADHD. There's a good amount of debate on whether they're distinct disorders, part of the same continuum. Jury's still out on that. What are the ADHD treatments? There's quite a few of them. Medications are probably going to be the most commonly recommended, in part because they are quite effective for a large majority of kids. Not for everyone. I don't prescribe medications, so I have no stake in this, but I do recommend them a lot of the time. They're really great at dampening some of that hyperactivity and giving kids a little bit of think time before acting, and they're a little bit more persistent when it comes to attention and focus. That being said, medications obviously have side effects. It's a very personal decision for families, but they also don't address a lot of the other areas that we know tend to be impacted in kids with attention disorders like ADHD, like executive functioning. They do not touch executive functioning skills. You could have a kiddo who responds really well to medications, but their disorganization is not going to really improve without additional intervention. And so one of the other interventions is really focused on environmental structuring. This is setting up the environment to increase the likelihood of success. We know that kids with attention difficulties and attention disorders, their brain processes motivational information and reward very differently. So we often have to set up the environment in a way that's more rewarding for things that we need them to do or want them to do. Behavior therapy, including parent training and behavior management, especially for younger kids, has been shown to be quite effective. And then executive functioning supports and more explicit instruction in organizational skills, planning, organizing, and time management. All of those together are probably going to be the most effective approach to treating attention disorders. And then some of the other ones, I already mentioned physical activity. That's a huge one. Good amount of literature on it, and also pretty easy to, most kids want to be active. So getting them involved in some sort of physical activity. That being said, many kids with attention disorders, because they're a bit more impulsive, might not be well suited, especially in those early years, to team sports, because that requires a lot of attention to what's going on around you and a lot of turn taking and collaboration with peers. Some kids don't do well with that. They do better with more individualized sports, but it depends on the kid. Some kids do great with team sports too. I talked a little bit about diet. A more recent area of literature has been on mindfulness. So these are things like yoga and meditation. And there's definitely some studies that show that this can be quite effective. It's inconsistent. We're not at a point where we have enough literature to really say yay or nay. But I think for some kids it works well. And it's definitely one of those interventions that doesn't really have too much of a downside, aside from time investment and a financial investment. So I think for some kids, that's a good thing to try. Biofeedback. So these are interventions that try to teach kids how to regulate and control their body and their bodily reactions, calming themselves down to control their heart rate or electrical brain activity. These interventions work for some things. They don't seem to work for attention difficulties per se. The literature that we have demonstrates that a lot of kids, while their parents seem to rate some improvements in people who are not familiar with the intervention history, don't see a difference in symptom presentation. I think this is an area that there's more research that's still needed, but it is demonstrating the effectiveness that I think everyone was really hoping for. One of the other diagnoses that is more common in kids with congenital heart disease is autism. And autism spectrum disorders, it's a very wide spectrum. There's kids who are more mildly affected, there's kids who are much more severely affected. So if you have any concerns, please talk to your team. But the two areas of symptoms that are seen in autism at varying levels of severity is persistent deficits in social communication and social interaction. And those have to include all three. So social emotional reciprocity, being able to have a back and forth social and emotional relationship conversation, difficulties with nonverbal communication, so reading nonverbal cues, using nonverbal cues, eye contact, gestures for the purpose of social communication, and then difficulties in developing and maintaining relationships and friendships at an age-appropriate level. And then the other set of symptoms is what we call a restricted repetitive patterns of behavior or interests. And that includes stereotyped motor movements, hand flapping, playing with fingers, or stereotyped speech, kind of using the same phrases over and over again, insistence on sameness and being very inflexible with routines. We have to brush our teeth before we get in the tub, and that cannot change, or there's a high rate of distress. Highly restricted interests. This might look like kids will only be interested in one topic or one toy or one area, and that's all they talk about. And all topics lead back to it. Thomas the Train, everything's about Thomas the Train or dinosaurs. Kids might be highly knowledgeable in a particular area, but that's the only thing that they're capable of talking about, and they're not able to then follow with a peer's conversation about something else. Sensory hypo and hypersensitivities. A lot of kids with autism do have a wide range of sensory concerns. Some of them have an underdeveloped sensory system, and some kids are overly sensitive to sensory stimuli. The best approach to autism treatment is really a multidisciplinary one. Early on, speech language therapy, physical therapy, and occupational therapy are very important. A lot of kids with autism have a lot of language difficulties, which then further exacerbates their social communication struggles. Right? Those therapies are often very much needed. Applied behavior analysis is a behavioral intervention that is geared towards specific skill development that's been shown to be quite effective at improving a wide range of daily living skills and self-care, as well as social skills in kids' autism. and really uses a discrete teaching methodology. So it's breaking a task down into its very discrete components and teaching each component at a time, and then chaining those components together into a larger skill. Social skills interventions, there's a wide range of them. Many of them are not as effective. There's a couple that are quite effective. One is called the Children's Friendship Group, and the other is called Peers, which is for teenagers. And they are also a discrete teaching methodology. They break social skills and social scenarios down into component parts and really teach kids the different aspects to a social interaction. And then they also coach parents to become the social coach throughout the week. So there's lots of repetition and reinforcement of those skills being taught. A lot of kids with autism do well with visual supports, visual calendars and visual schedules and things like that, as well as even visual communication tools for kids who might be nonverbal or who might have a particular difficulty with verbal communication. And then social thinking program, teaching kids to think about other people's thinking. One of the core cognitive difficulties in autism is called theory of mind, being able to really put yourself into another person's experience and take their perspective. Kids with autism really struggle with that. So programs that are developed specifically for teaching how to take another person's point of view can be effective.